Okay, so now we're going to talk about discharge instructions. And this is going to be based on an article from the Annals of Emergency Medicine, August 2012. And here's the article. And I know what you're thinking. Come on, man. Discharge instructions? Boring. But stick with me. Let's at least learn how to do these things right. Now, most commonly what I see is that this area is just left blank, and maybe you pick one or two of these generic discharge instructions to send the patient home with. Occasionally someone will write something in there too, maybe return a course or follow up with your doctor. Hey, that's better than leaving it blank. Or sometimes a diagnosis placed in here, like this. You've been diagnosed with a retroperitoneal bleed. Now, most patients are not going to know what that even means. But my all-time favorite one that I've seen was a resident who had discharged a patient home with asthma and wrote this there. Which, to physicians means follow up if short of breath. But what do you think that means to the layperson? So you should really use your discharge instructions to communicate to your patient. And if you think about it, this is the information they're going to take home, and this is the information they're going to spend the most time with. And yet this is the thing that we probably spend the least time with. We just throw something together, print it out, and give it to the nurse to discharge a patient, and we don't even explain anything. And we really can do better. This should be a moment of bidirectional communication between the patient and the doctor. No, not even the doctor. Between the patient and the healthcare team. You could take this opportunity to do a couple of things. You want to summarize the visit to the patient. You want to teach them how to take care of themselves at home. You want to answer their questions. And finally, you want to help connect them with their doctors or primary care providers. So what goes in discharge instructions? I like to include four main things. The first is their diagnosis. What did you diagnose them with? Let them know what they're going home with. And as in this case, cellulitis. They might not know what that word means, so you have to explain it too. A lot of time those pre-printed, pre-made discharge instructions are not going to do a good job of explaining the nuances that they have, so I like to put that in there myself as well. And sometimes their diagnosis, there is no discharge instruction for that, so you have to come up with your own. The next thing that I like to include is a summary of their emergency department care. So I like to give them that quick summary there in language that they understand. The next thing you want to do is explain to them what they need to do at home. And so here I like to explain any medications that they may be on and try to tell them how to take it, any other instructions, as well as when they should follow up with their doctor. I think it's important to give them a time frame, because if you just say follow up with your doctor, they don't know if that means in 2 months or 2 years. And so give them a time frame. Not only is this good communication to the patient, medical legally it can protect you as well. And then the last thing I like to keep in here are return instructions. And so what Mike Marianowski taught me today was to put this word immediately in here. Again, like with this 2 days thing, a time frame is important, because a patient might see something bad and they say, well, they told me to return, but should I go today? Should I go in a week? I'm not really sure. So you just say return immediately if anything is worsening, and put specific things that you're looking for: redness, pain, fever, pus. But I also like to put this in here, this or any other concerns. That catch-all helps you too, as if there's something that worries a patient, they come back. But also, again, medical legally, if something were to happen, you could always fall back and say, hey, look, I told them to come back immediately if there was something concerning. And they didn't, but I told them to. So let's quickly summarize. The 4 things that you should have in your discharge instructions is a diagnosis with an explanation of it, a summary of their hospital or emergency department course, again, written in a language that they can understand, instructions for what they're supposed to do at home and follow up, as well as return instructions when they should come back. So next, let's look at where we slip up. The first thing is content. Did you put all 4 of those things in your discharge instructions? Did you tell them their diagnosis? Did you tell them to not take Tylenol when they're taking Norco? And so how do we fix that? Well, I like to use templates, those dot phrases in Epic. Those can be very helpful here. So here's a very simplified version of what I use, but you get the idea. You've been diagnosed with blank, which means blank. Your test results in the ER show blank. Return immediately if blank, and I always have after here, or other concerns. Then follow up with your doctor on blank, so you're giving a time frame. The next place that we mess up is in delivery. That's when we are providing information, they just don't get it. So you might write your instructions at like a high school reading level, and they're at a grade school reading level. So I like to try to make a quick assessment of whatever their health literacy would be, and then I try to tailor their instructions to that level of understanding. And the final area where we mess up in is in comprehension. Most of us don't assess if our patients understand what we just told them. One thing that I like to do this is I like to go over the discharge instructions with the patient myself, and I explain everything in terms I think they can understand and let them ask questions. But then I don't let them go. I have the nurse go over everything with them again as well. If you hear it 2 times, you're more likely to get it. And also, I find that patients don't like to ask the doctor the questions. They only like to ask nurses that. I don't know why. Maybe they just feel anxious to ask me, or maybe in the time in between talking to me and talking to the nurse, they've developed their questions, and now they've actually had time to think about it, and so they came up with the questions then. So that's why I think it's important to have both people talk to the patient. There's been something called the read-back, teach-back communication strategy, in which the provider will have the patient assess their recall and comprehension. And so this does work. However, the patient's not liking it because they might feel like they're being quizzed. So again, in summary, the things that I like to put in the discharge instructions is their diagnosis, a summary of their ED course, home care instructions including follow-up, and return instructions. And both those last 2 should have time frames with those. Remember to put them at the level of understanding that the patient is at their health literacy level, and it helps to have someone else explain it as well. We're a healthcare team, nurses, doctors, we all work together.